We all need to go on a diet. The food we eat is killing us, and the food makers are the ones holding the rope we're hanging by. Healthcare is what we eat as much as how much we exercise, whether we smoke or drink, and our medical history and genetic determination. In America, how we treat illness is called healthcare, and exercising, being healthy, and eating food that is good for you is called dieting. Doctors too often have to treat diseases instead of providing care to prevent the illnesses in their patients. And they get paid better to treat a disease than to prevent it. The food we eat is poisonous, and the government, under the influence of big money, is telling us it is healthy. For example, how long have we been eating hydrogenated oils only to find out recently that they're hazardous to our health and they're beginning to ban them? I heard in the news about the pink slime, and a lot of people were outraged to find out it's in meat and gristle cleaned with ammonia and fed to our kids in hamburgers at school. So people were so outraged about it, it began pulling it from our schools while it's turning back up in our schools. Are you aware that the GMOs created by Monsanto are banned in most countries for being unsafe, but Americans consume as much as they can without knowing what they're eating? Healthy foods are becoming an economic issue, and the small farmer is forced to buy GMO crops and spend even more money on pesticides and fertilizers that are designed to go with a specific type of seed that bears fruit that the farmer can't sell overseas. We could all do better to support locally grown organic produce. More money stays in the local economy, and we all eat a better diet. What about the ground we grow our food on and the water we use to nourish the roots and stems of the plants we grow for ourselves and the animals we eat? Back when I first started learning about computers, a common phrase was always said, garbage in, garbage out. And the same is said about the food we grow. If we feed plants dirty water, they don't grow, or worse, they die. If we feed our animals bad food, they get sick and they die. Or they get sick, we eat them, we get sick and die. Loosening regulations have allowed corporations to poison our water and soil. Those regulations are laws to protect the citizens from harm, the same as the laws that tell us to stop our car at a red light. The right-wing Republicans and Libertarians want to get rid of those laws that protect our health and the health of our children and our environment. Let's take a step back and look at the history of healthcare. In the beginning of healthcare, it was up to somebody to know what herbs were good for an ailment. Then we had big wars and crusades where soon nuns and monks were creating places for the sick or wounded people to get healed, all at no expense. As our country expanded and rural areas began getting doctors that took payment in barter, say a chicken for fixing a broken arm, then charitable organizations and churches began building hospitals for research and assistance to the communities where they lived. People began to pay for health care, but only what was reasonable and what they could afford, and sometimes a barter would enter the picture. Then in the late 1960s came managed health care and insurance companies who began to get between patients and their doctors, but America didn't want socialized medicine. We can't let the government get between us and our doctors, but we can allow our insurance companies to get between us and our doctors. Every piece of legislation passed by Congress since Medicare and Medicaid was written to give advantage to insurance and pharmaceutical companies. The majority of Medicare fraud is on the part of doctors and hospitals, charging for unnecessary tests and procedures at rates 10 times or more over the amount of cost. Allowing the profiteers of death to write a check they charge our government for the care of sick is immoral and should be illegal. So what's my answer? We need universal single-payer health care to reduce the costs. Sure, America has the best medicine in the world, but we also have the most expensive and the least effective. The highest infant mortality rate in the world is the testament of the poor results we get for the most expensive treatment. A single-payer Medicare for all plan will be, at the very least, able to bring down the cost to make the best care more affordable to all Americans. Keep in mind, garbage in and garbage out, we need to provide for inspectors at meat processing plants and industrial farms, more testing on GMO crops before they're sent to markets to ensure no long-term adverse health effects before they're brought to the market. More incentives for local small crop farmers or families who grow their own food. We need tighter laws to protect the environment from pollution and ecological terrorism, as displayed in the chemical spill in Kanawha Valley by Freedom Industries, and the disaster in the Gulf of Mexico, the spill in the Great Lakes, the explosion in West Texas, the pipeline ruptures in Arkansas, Missouri, and Ohio, the pollution caused by fracking all over the United States. If we cannot use the water or the land to nourish the food we eat, we cannot use it for our own nourishment. We must decide if our legacy is to provide a healthy life and living for our population, or do we choose to kill God's creation and ourselves? I'm Dennis Lambert, and I approve this message. On May 6th, for the 6th District, vote for me, Dennis Lambert. And when you grab that Green Party ballot, vote for Anita Rios for governor and Bob Fitrakis for lieutenant governor. Write those candidates in on your ballot for governor and lieutenant governor. Anita Rios, Bob Fitrakis. Thank you for supporting democracy.